Hi, so I'm going to help you with slide 8. So hopefully by now you've already watched the video on iLearn. So this is going to help build off of what you just learned about. So the first thing you're going to do is click on this link for the ehealthinsurance.com, and that's going to open up this tab. So the first thing you're going to need to do is put the zip code for where you are living. So my house, going back to one of the earlier slides, was in the zip code 48073. So then you're going to click Get Quote. So I live in 4803. I am not a business owner with employees. And remember, it says on the slide to put that you are not a business owner or small business owner. So when it gives you the option between Affordable Care Act plans or short-term plans, you are going to choose the Affordable Care Act plans. These insurance plans down here are only going to give you insurance for like 6 months. You need insurance full-time. So that's why you're choosing Affordable Care Act plans. So I'm going to put that I'm female. I'm going to make up a birth date. You have to put that you are over the age of 21. So that would be 1999 or before. So I'm going to put that I was born, let's say, September 25th, 1995. And we're going to put that I do not smoke. And I do not have a spouse, and I do not have a child. And you are not going to add spouses or children either. So I make over $49,000 a year. So I'm going to say, is your total household income more than $50,000 a year? Yes. And then I am going to put that I just want to see unsubsidized plans. This is just going to make things more complicated if you do the see if I qualify. So choose see unsubsidized plans. So it's saying that there are 83 insurance plans that are available to me given these characteristics. So I just want to take a look at a couple of them. So let's take this HAP Personal Alliance Catastrophic. So whenever you see catastrophic on a insurance plan, it means that it's really only good for emergencies. Okay, so notice that it has a pretty low monthly premium. So you're only paying about $150 a month. However, your deductible is $8,150. So you are going to end up paying the first $8,000 of your medical care. So let's say you get in an accident, you're working at home, you fall off a ladder, you need $10,000 worth of medical coverage. You are going to be responsible for the first $8,000 of those dollars. Okay. But after that, it says the out-of-pocket limit is $8,150. So after you hit your deductible, they are going to pay everything. But you have to make sure then that you have $8,000 in your savings account at all times in case you do have some kind of accident that you end up in the hospital. So let's look at another couple plans. Let's go with this second one here. So the next one, we have this Blue Cross Select HMO Silver Off Marketplace. So the deductible, notice you're paying a little bit more for your premium every month. You're paying $250 instead of the $150 for this plan up here. But notice how much less you're paying for your deductible. So for this plan, you only have to pay $2,600, and then they start paying. Here they had to pay you have to pay $8,000 before your insurance company will pay anything. So if you are someone that has some health problems already, this is probably the plan for you so that you don't have to pay that full $8,000. If you're someone who's reasonably healthy, you could go with this plan and save yourself a little money each month. All right, so that's kind of how to read these. Also, it tells you what your copays are. So if you wanted to go to your primary care doctor, let's say you think you have an ear infection, you want to go in and get some medication, you'd have to pay $30 to see your primary care physician. Let's say you are playing football, you get knocked over, you think there's something wrong with your leg, you need to go see an orthopedist. It's going to cost you $50 with this plan. And then if you need to go to the emergency room for any reason, it's going to cost you $250 for a copay. And then anything after that $250, you're paying 30% of.